Okay, now we're live. Sorry about that, guys. I've been having some internet troubles, so if I'm super slow tonight, that might be why. But um, tonight we're actually going to be talking about the benefits of breastfeeding. And what I actually wanted to do today is start out by saying that breastfeeding is not for everybody. It's a very personal decision, and each mom has to weigh that decision with herself and her family and what's best for herself and her family. So, while we're going to be talking a lot about breastfeeding this week, in the next following weeks, I don't want any formula feeding moms to feel left out or to feel bad because generations of moms have fed their babies on formula and they have grown up just fine. So I wanted to say that before we dived into today's topic about the benefits of breastfeeding because some moms choose not to breastfeed and that's okay. You know, the ultimate thing is that your baby is being fed and nourished, whether that's breastfeeding or formula feeding. So, like I said, we're going to go into the benefits of breastfeeding, but if you have formula fed in the past or you're deciding to formula feed your baby in the future, that's okay. You're not a bad mom. I promise. I promise. And if someone says otherwise, you can send them to me and I will give them a piece of my mind. So, you have my permission to send any haters my direction. But saying that, we are going to talk a little bit about the benefits of breastfeeding today. And again, I am sorry my internet connection is bad. So if I'm a little choppy tonight, that is why. Um, but let's go ahead and dive into the benefits of breastfeeding for moms. So, there's several benefits of breastfeeding for moms, and when we think about breastfeeding, we usually think about the benefits to baby. But the number one benefit that moms find is that creates a really special bond between them and their baby. So while you have that bond if you're formula feeding, there's just usually more of that bond if you're breastfeeding. So you get that special bond with your baby. Another benefit is that women who breastfeed and the longer they breastfeed, the lower their risk of ovarian and breast cancer. So, breastfeeding actually reduces your risk of cancer. Another thing that is a benefit for mom is it helps prevent osteoporosis after menopause. So, osteoporosis is where your bones become more brittle, and typically that happens after menopause. So, breastfeeding can actually help moms prevent your bones becoming brittle after menopause. Breastfeeding also helps you lose weight after delivery. And what I mean by this is breastfeeding, I like to call it an Olympic sport because you burn an average of 500 calories a day extra by breastfeeding. And you also burn about 500 calories if you run 5 miles. So it's like running 5 miles without actually running 5 miles. So it's really great. You can call yourself a breastfeeding athlete because you're burning 500 calories whilst doing nothing and sitting on your couch. So that's a really great thing for moms, and that actually helps you lose weight after delivery. Another thing that it does for moms is breastfeeding helps your uterus shrink back to its normal size quicker than if you were not breastfeeding. And it also may reduce the risk of postpartum depression. There's kind of mixed results out there of breastfeeding and postpartum depression, but there's a chance that it could reduce your risk for postpartum depression. And now, my favorite benefit of breastfeeding is that it is convenient. There is no need to heat any bottles. You're in the middle of the night, you don't have to worry about improperly mixing your formula and sticking the bottle in the baby's nose because it's just the middle of the night and you just don't want to do that. Just plop them right on the boob and you're good to go. You can have it anywhere at any time. It's always the right temperature and it's always there. So that's probably my favorite benefit of breastfeeding. So those are some of the benefits for mom. Now let's transition over to some of the benefits for baby. So for baby, if a baby is breastfed, it actually reduces their risk for respiratory illness. It reduces their risk for eczema or other skin conditions. It reduces their risk of sudden infant death syndrome or SIDS. It also reduces their risk for later in life developing diabetes, obesity, food allergies, celiac disease, Crohn's disease, ulcerative colitis, which are all irritable bowel disease symptoms. It also can help prevent ear infections, all that great or not so great stuff. And then I don't know how conclusive this is. I didn't look too much into these studies, but there are some studies that show that breastfed babies might actually have a higher IQ than formula-fed babies. Now, like I said, I don't necessarily know the validity of those studies, but that's what some studies are saying. So if anybody has questions on the benefits of breastfeeding for moms and babies, let me know. I can dive a little bit deeper into those, but those are the benefits. Now, I also wanted to include tonight some of the common breastfeeding true and false questions that I like to ask moms, some of the misconceptions. So, I'm going to ask a question, and in your mind, I want you to think if it's true or false, okay? Okay, no, I need to rephrase that. Avoiding allergen foods while breastfeeding, like you as the mom, actually prevents your baby from developing those allergies in the future. Is that true or false? So, if you, the mom, eat peanuts, does it prevent your baby from developing peanut allergies? True or false? I'm singing Jeopardy in my head. Okay, so that is actually false. Studies show us that what mom eats in terms of potential allergens, like peanuts, soy, things like that, does not prevent or decrease a baby's chances of getting that allergen. So you can actually eat as many peanuts and as much soy or sesame as you want, and it's not going to prevent your baby from getting those allergies, and it's not and avoiding them is not going to prevent your baby from getting those allergies. So you can eat whatever you want. Okay. Now on the flip side of that, some babies might be lactose intolerant or have a gluten sensitivity. So if your baby happens to be lactose intolerant or has a gluten sensitivity, you as the mom, if you eat those foods, if you eat dairy or you eat gluten, that can actually affect your baby. So say your baby is excessively fussy. Maybe they've got a lot of GI issues. Your pediatrician might say, how about you cut the dairy out of your diet for a couple of weeks, like a week or two, and let's see if your baby gets better. If you cut dairy out of your diet for a couple of weeks and your baby's symptoms go away, then they might be lactose intolerant. And you can tell that because one, you took the dairy away and the symptoms went away, but the way to test that is you reintroduce dairy in your diet, and if your baby's symptoms come back, then you know that they're lactose intolerant or that they might have a gluten sensitivity. Now, not a lot of babies have gluten sensitivities, but some babies do have lactose intolerance. So that's something you can kind of play around with your diet. Okay, next true or false question. Eating gassy foods like broccoli and cabbage and beets can cause your baby to be gassy if you're breastfeeding. Is that true or false? So there's kind of some mixed results on this. So most studies say false. Eating things like cabbage and broccoli and kale and things that are called cruciferous vegetables, do not cause your baby to be extra gassy. And the reason for this is when we eat those vegetables, the reason that they might make us gassy is because our body is digesting what the fiber and the cruciferous vegetables, and that's what's causing us to be gassy. Well, that fiber from those vegetables does not transfer from you through your breast milk to the baby. Now, some mamas swear that eating broccoli or cabbage causes their babies to be extra fussy. And if you think that's the case and you take those out of your diet and your baby's not as fussy, I mean, by all means, that's fine. But the reason I don't necessarily recommend taking those foods out of your diet is because those are really healthy foods. You know, broccoli, cabbage, kale, Brussels sprouts, all those things that are cruciferous vegetables are really healthy in your diet. And so taking them out isn't necessarily a good thing. So that's kind of a question that some moms have. So another true or false question, and okay, I'm just going to state this. It's kind of a trick question, so think about it. What you eat affects your breast milk. True or false? What you eat affects your breast milk. Now, I said that this was kind of a trick question, and the reason I say that, the false part is it doesn't matter what you eat, the composition of your breast milk is going to be what your baby needs. So what I mean by that, it doesn't matter how many carbohydrates you eat. It doesn't matter how many grams of protein you eat. It doesn't matter how many grams of fat you eat. Your breast milk is going to contain the appropriate amount of carbohydrates, fat, and protein that your baby needs. So that's the false part of that statement. Now, the true part of that statement, some things that we eat can affect our breast milk in the fact that I mentioned earlier. Some babies may be lactose intolerant, so if you take lactose or dairy out of your diet, it can take the lactose out of your breast milk. So that's something that can affect your breast milk. Another thing, and this is what leads breastfed babies to be less picky eaters when they grow up, is that when you eat different flavored foods, like say you eat a really nice Indian curry, or you have a really great chimichangas, like all those different flavors in your diet are going to cause the flavor of your breast milk to be a little bit different each time your baby has it. So, whereas formula-fed babies have the same flavor of formula every single day, a breastfed baby is going to have a slightly different tasting breast milk every time they feed, depending on what their mama eats. So that's why we say breastfed babies are less picky when they grow up, because they're exposed to all these different flavors in their breast milk. So that's a really great incentive as well to make sure that you as the mama have a different flavor in your diet as well. Okay, next true or false question. Breastfeeding hurts. True or false? So this is actually false. Now, if breastfeeding hurts, there's something going on, because breastfeeding should not hurt. Typically, when breastfeeding hurts, your baby isn't latched on properly. And fixing that latch, or fixing the way that you're holding your baby so that they can latch better, usually fixes that. Sometimes your baby might have a tongue tie, or they might have a lip tie. And if that's the case, getting that tongue tie or that lip tie fixed can help the latch, which leads to your breastfeeding not hurting. So if you are breastfeeding and it hurts, talk to a certified lactation consultant, come to a great one for moms that I get a lot of questions about. So true or false, You should not breastfeed if you are sick or taking medication. True or false? So this is false. It is actually recommended to breastfeed while you are sick. And the reason for this is when you, the mama, are sick, your body actually creates antibodies to that illness. And when you breastfeed your baby actually gets those antibodies. So 2 years ago, right, at the beginning of all this COVID stuff, we were worried about moms breastfeeding their babies if they had COVID. But what we found is that moms who had a mask on while they were breastfeeding their baby so that they didn't, have the respiratory stuff making their baby sick, so that when they washed their hands but they breastfed their baby, it was helping transfer the antibodies of COVID to the baby to help their immune system. So that's why it's really important to breastfeed your baby even when you're sick, as long as you know you're washing your hands, you're not coughing on your baby's face while you're breastfeeding them. So that's one of the good reasons to breastfeed, is because you're transferring those antibodies over. Now, I also said, can you breastfeed while you're taking medications? So this depends, and this is why it's really important to talk to your doctor about any medications that you're taking. Some medication is safe to take while breastfeeding, and the reason is because it does not pass from you into the breast milk, whereas some medication does pass to the breast milk and therefore passes to your baby. So it really depends. You can always ask your doctor. For example, there are some anxiety and depression medications that cannot be taken while you're breastfeeding, but there are some anxiety and depression medications that can be taken while you're breastfeeding. So that's why it's important to ask your doctor, because you might just have to do a simple switch in medications. So say the medications that you're currently on you can't breastfeed with, but if you switch to a different kind of medication, you should be able to breastfeed. So that's where it's really important to talk to your doctor about that. Okay, so we have 2 more true/false questions here. So true or false? Breastfeeding is an effective birth control method. True or false? So this is actually false. A lot of moms think because typically when you breastfeed, it takes a little bit longer for your period to come back after you give birth, that breastfeeding is a birth control method. But that is not the case. You can get pregnant while you're breastfeeding. So you need to make sure that you are talking to your doctor about a family planning method, because some birth controls can hinder your milk supply. So that's why you want to talk to your doctor, tell them that you are breastfeeding, so they might recommend a different type of birth control. Now, the last true or false question here, breastfeeding comes naturally. True or false? So this is false. So while breastfeeding may be biologically natural, meaning that it happens, it's like learning a sport. So the first time you learn a sport, you're probably not that good at it, but you have to practice and practicing often, and you get much better. Now think about your little one. Your little one is just born. They just entered the world. They know nothing. So it might take them a few days to learn how to latch properly. Might take them a few days to learn how to breastfeed. And maybe they are not that good at the beginning, but that's okay because it's like a sport. You have to practice. You have to practice frequently to get better at it. So a lot of moms get really discouraged if their baby doesn't latch on right away, if they kind of struggle the first couple of days. But if you stick in there, if you talk to a lactation consultant, and you really practice, it gets a lot easier. Now, I'm not saying it's the easiest thing in the world, but it does get easier. Well, mamas, I really hope that you enjoyed tonight's live stream. We covered the benefits of breastfeeding for mom and baby, and then we went over some of those common breastfeeding misconceptions and some true or falses out there that come along with breastfeeding. The next couple weeks, we're going to still dive into the topic of breastfeeding and cover different areas. But if you're interested in getting the link to my Breastfeeding What to Expect class, it's free to all mamas in this group. We do it once a month. So actually next Wednesday at 7 p.m. Eastern Standard Time, we will be doing the Breastfeeding What to Expect class via Zoom. If you're not able to make it live, I always have the replay available for moms. So if you want to watch that class, it's about an hour long, message me or put it in the comments and I'd be happy to send you the link to that replay from our March class. So mamas, I hope you have a wonderful rest of the day. And if there's any topics or questions about breastfeeding that you want to know more about, please feel free to message me, let me know, and we can dive into those in the next couple of weeks in our training sessions. So you guys have a wonderful rest of your weekend, and I will see you next Wednesday.